Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this finds you well, and hopefully this information can even make you better. So share with others. And I know you already know where to find us, Longevity Health Institute Inc.com, and here in Rochester Hills, Michigan, Madison Heights, Michigan, and soon to be Bloomfield, Michigan. So me and my practitioners always work on the best in functional integrative medicine on a personalized level. And somebody today just asked me this about, hey, can I be your primary care doctor? Well, that's what I am. I am also a board certified family practice general practitioner. So we do a lot of primary care. We just do a little different. We're going to look at root causes. We're going to really focus on prevention and wellness, advanced, screening tests. And, it's going to be a little bit different than just the general fluff and buff and here's your script and Band-Aid and have a nice day. The example, we see about 15 people a day, not 50. So we spend time with you and get to know you and dig into the root of your issues. Today I want to share with you and talk to you about something that just apparently this week, I don't know why, but I've seen a lot of, and so I want to really stress about a antibiotic medication that we use, and we've used for a number of years, but we really ramped up use because of some of the coverage of it and the benefits of it. But if you've heard of SIBO, or small intestinal bowel overgrowth, which also can fall under like an irritable bowel, and especially irritable bowel with diarrhea type of bowel condition, very common, very prevalent. We do tons and tons of GI care here. We see so many patients with gut and GI issues. And you've heard me say this before, you gotta have a good gut. It's your immunity. 70-80% of your immunity is right here. How you eat, how you absorb. At that cellular lining in your intestinal lining, that's your immunity. So it's gotta be good. So IBS and irritable bowel and digestive issues like reflux and bloating and etc. are not acceptable. Don't let them be acceptable. Don't Band-Aid them with Rolaids and Tums and omeprazole and PPIs and that, because you're not helping yourself. You're Band-Aiding a wound. So anyway, there's a medication, okay, that's used that has wonderful results, and we've been recently being able to get actually better coverage on it. It's an antibiotic called Xifaxin. It's actually an old drug or a version of an old drug that's used to kill off any bad, essentially dysbiotic bacteria of the gut. And so it stops the protein synthesis of bad bacteria so they don't replicate. And so when we use those with actually a good medical grade quality probiotic, we build up your good gut stuff as we knock off these bad guys that can give you things like small intestinal bowel overgrowth, which gives you a lot of bloating symptoms, indigestion, nausea, burping, heartburn, cramping, dysmotility, and give you a lot of discomfort, essentially, even GI, just sensitivity and discomfort. So when you use an antibiotic like Xifaxin, which usually we'll use for a couple weeks, and if we need to, we can use it for as long as 4 to 6 weeks. And we also use natural things to actually also along with it once in a while or after it if there's a little bit of residual symptoms like berberine or oregano tablets. But you got to use good quality probiotics too to build up the flora, okay, as you kill off some of the bad guys. We often see people that have seen literally 4 or 5 GI doctors, been scoped up and down, no answer, PPIs, omeprazole, Prilosec, Nexium, all these don't help them. And we find out and get to the root cause by some testing or looking at our live blood tests or our breath tests or our specialized blood tests that we do that look at inflammation and antibody reactions. We can tell you what you have. We use Xifaxin very effectively, none basically to very limited side effects. And people start to lose all these symptoms and start to feel wonderful. And again, that gets to better immunity, gets to better absorption, gets to better bowel habits. So, things just work really well. And you have to remember, it all boils down to gut health and pooping. So everything boils down to health is, what you put in the toilet. But it's very important, super important, okay? Don't accept that as just a symptom that you can band-aid, okay? The other thing I find very interesting is, and I've seen this for years and years here, okay, this is a new study in the Journal of Clinical Gastroenterology and Hepatology, that there's an association between dysbiotic guts and non-alcoholic fatty liver. And you've heard me talk about liver conditions and fatty liver and all that. And I believe it's because of what you can get is a lot of cross-linkage and a lot of inflammatory sugar effects when you have leaky gut and IBS and that can then inflame your liver, okay, because it's in your blood, etc. So non-alcoholic fatty liver too recently on a study that was over 2 million people had showed between a 10-year study, 2007 to 2017, over 2 million people showed that people with non-alcoholic fatty liver and or had alcoholic liver disease had 11% annual increase in mortality. It's terrible. And we're seeing epidemic rates of non-alcoholic fatty liver. Fatty liver is everywhere, and you've heard me talk about that. Don't live with fatty liver because we can reverse that too. So anyway, take this message, please absorb it, share with others. You know, we're here for your personalized prevention, primary care, wellness care. You know, we're passionate about what we do. We love taking care of you, and we love getting you better, and you literally send others because you're on your way. So remember that, okay? Don't band-aid your symptoms. So, and use Xifaxin, and we use Xifaxin, this wonderful antibiotic that's got great relief of this digestive trouble, and we'll give you the best direction in digestive health and resolving some of your digestive functional symptoms. So, this is Dr. Lewerenz, Longevity Health Institute in Michigan here. You can find us and follow us on the web, follow our YouTube channel. You know, we have the best supplements in the pharmaceutical medical grade world. We always direct you in that. We direct you to websites that have that, etc. And we have them here. But we're always happy and passionate about bringing you the best and functional personalized medicine. This is Dr. Lewerenz. Be well.